Connie Pringle once again. And today, what I would like to talk about is in orientation and the global criteria. And then I'll go into assessment as well as the global criteria for assessment. And just remember to keep in mind that this is only a study guide that's to be used along with ready to test manual that is has been put together by the IC&RC board. All right, orientation. Orientation is where you would orientate the client to your particular program, whether it's detox or outpatient or inpatient or residential. You want to have the client be familiar with your agency, like what's the rules, what's the program goals, where the restrooms are, times of operation, emergency contact person, telephone numbers, who their clinician is going to be working with them. You just want to give them you want to go over the rules, the expectations, especially the rules that can get someone removed from the program. A lot of times you may have to go over the rules and over again, because when a person first come into treatment, they may just say yeah just to get in. However, so you always want to go back and remind them again of what the rules are. One way that we used to do in outpatient is to have the clients say what the rules are when someone first come in. Someone comes in, introduce themselves to the group, and so the group will respond and tell a little bit about themselves and also go over the rules. Because that's important. You don't want them to bring drugs on the premises. You don't want them, some of the major ones, you don't want them to bring drugs on the premises. You don't want them to become involved in relationships. Definitely no violence. Don't bring any weapons on the property. No threats of violence. Those are some of the major rules that we want clients to be orientated to. Also, just letting them know some of the things of what they could expect while they're in the program, like education sessions is going to take place. You will receive therapy once or twice a week. Our major function may be group therapy, and how important it is for a person to attend all sessions in order to benefit from the program. Just always keeping in mind the program goals, and not necessarily just the program goals, but also the client's goals. You want them to buy into what the program goals are. So you always want to, remind them of why they're there and what they can gain if they fully participate in your program, because that's what you want. You want the client to be able to walk away from treatment feeling good about them. The overview of orientation, just making sure that clients are aware of the hours, the location, their counselor, who their counselor is, and the program goals. When I go into assessment, we're still gathering information. And remembering at the beginning, during screening, you started gathering some information. So you want to keep all that information in mind, even from the screening. When you began screening, at the beginning of the screening, you started gathering information, asking clients questions and things of sort. So you want to keep that in mind. Gathering just psychological, social, legal, just reflecting back on those areas that you gathered the information from. And not just about substance abuse, mental illness and illegal issues. Just go, gather more information about that, okay? And then you want to identify methods of how you're going to gather this information. So if you can get information from a probation officer, a DSS worker, and if they have a support system, you want to gather information from their support system as well. And to know that, any significant others that they may have, or wherever else, if they were in a past treatment center, if they had past treatment experience, or they've been in a mental health facility or a hospital, if you can get that information together to look at along with your record, it will truly help you to come up with the diagnosis, because that's one way of coming up with the diagnosis. You gathering information, doing the assessment to help you to come up with a diagnosis, along with developing the treatment plan, which we will talk about later on. But going back into the global criteria of assessment, and keeping in mind that there are about 5 global criteria to assessment, you can bet your bottom dollar that there's going to be some questions on there in reference to assessment. You want to keep that in mind. So when thinking about the assessment, you want to look at the tools that you plan on using. I know I mentioned helping you to come up with a diagnosis is what it's going to help you do, but when looking at assessment tool, I'm talking about maybe the DSM-5, keeping in mind the demographic information, the biopsychosocial, the information that you gathered, that's one tool. If you use SASE, with SASE, really helps you to, determine where a client is, if they're being honest with you or not. There's a lot that a SASE can do. I love using the SASE when determining whether what program someone needs to go into, and just to look at how honest they are. So the SASE works well. There's also the SOTS. We're working with DSS. They pretty much always like to also include an emotional assessment or something that has to do with domestic violence. So there are several assessment tools out there. Just be mindful of a few. You should know some for yourself, different things that you could use. A lot of times agencies handicap you by just presenting to you the clinical comprehensive. Want you to use your assessment, and then they may have a breathalyzer that they want to include, or they may use drug screens as well to help them along the way come up with the diagnosis. However, you don't have to limit yourself to that. There are so many different assessment tools out there that can help you to determine a person's need for care. Also, you have to make sure that you explain to the client what you're doing. A lot of times when the client come in, we just expect them to just sit down and just give me all this information. I'm asking you about your life history. I'm gathering all this information without explaining to the client why you asking them all those questions. I think if we take the time out, because they have a right to know, to explain them the rationale as to why we may need to talk to the probation officer or the DSS worker. Just explain to them that I'm gathering all this information to help me to understand what's going on in your life, what's been going on in your life, how we can help. We want to be able to gather enough information that we can develop a treatment plan. Want to look at your strengths and your weaknesses Want to look at the strong areas because it's not all bad. Just because you got caught up in drugs and alcohol don't mean that your life is over. So you want to explain those things to the client, okay? And you also want to explain to them the diagnosis. Sometimes I have been in this field for a long time, and I have seen where clinicians were afraid to tell the client that they were diagnosing them with alcohol dependency or opioid dependency, that they didn't want to inform them of that. But it's important. The client needs to know what his diagnosis is. And what the plan is going to be to help him to get better. Also being able to not just diagnose, like I said, the substance abuse use, but we also want to look at if there's any co-occurrence disorders. We looked at that at the beginning in screening. We touched on it a little bit, but we want to look a little bit further and gathering information from outside resources will help you. Will help you better. A client may not tell you that they can't read, or they can't write, or that they struggled in school. They may not want to tell you that. But if a parent can tell you that they had trouble in school and they dropped out when they were in the 6th grade or the 7th grade, that's some added information that we need, because, you don't want to just be using these big old fancy words and client don't even understand what you're talking about. So you want to be able to know, not to say you have to stoop all the way down to a client's level, but you want to be able to make the client feel at least safe and secure while they're in your site. Because remember, from the beginning, we're building rapport. I just would like to highlight some of the things I talked about. I talked about orientation. Is that you orientating your client to your particular agency. The program goals, that's important that they understand that, what the purpose is, why they're here. A lot of people say, oh, I don't know why I'm here. When they leave your agency, you want them to be able to tell someone what they learned while they were here, and want them to be able to say, yes, this is a safe place where I'm at, and this is what they do. We just don't get you get your DWI license back. I mean, we're not, or you get your kids back. That is not just the program goals. Though that may be your goal of why you're here. However, the program goals is what the agency would like to see happen, which usually their mission statement usually says what their goal is. It usually is to help people to live a better life without the use of alcohol or other drugs. We're talking about assessment, remembering that it began at the beginning, and with it having like 5-6 global criteria, you could assure that the majority of the test is going to be in that area as well. So keep in mind the gathering of the information, the rationale, explaining to client, be aware of the assessment tools that you may use, that there's more than just one tool to use, and just keeping all that in mind. Okay, I'll see you next time.